So yesterday, the Centers for Medicare and Medicaid Services, or CMS, announced that they were placing a temporary hold on paying any physician claims as a result of the government shutdown. Now, this hold actually started on October 1st, although it's unclear how strict they were about keeping the hold. But it does appear that this is going to be an issue that's going to be in limbo until the government shutdown resolves. Now, anytime you're in private practice or anytime you're working in any kind of business, you always plan your business accordingly to be able to tide through times when reimbursements may be lower. So it's something that we oftentimes tighten our belt over and do our best to keep our staff and ancillary staff paid through the holiday season as best we can. It's important to note, however, this type of shutdown does have broader implications in the overall health systems. Specifically, certain critical services such as ambulance transfers, ground ambulance transfers, as well as funding to federally qualified health centers are going to be affected. And these oftentimes affect patients that have critical medical conditions, as well as patients that are oftentimes indigent patients that are oftentimes relying on these centers for their health care. So this could have wide-lasting ripple effects through the health system, particularly involving patients who are the most vulnerable and most in need. So in spite of what side of the aisle you lie on, whether you're Democrat or Republican, it's important for all of us to get this shutdown resolved, and hopefully this is something that you can talk to your legislator about finding an amicable resolution so these services are restored to patients.